Trimming the study models. We need to first start with cast study models. They're made from a variety of materials, from plaster to stone. You'll need a grinder. You probably want to first soak your models for about 10 minutes so it makes it easier to trim. We want to remember that the models in cast are a positive reproduction of the oral cavity and the oral conditions of the mouth. The study models are diagnostic, and they're a vital role for dental treatment and planning. They consist of a base portion and an anatomical portion, or the tooth portion. Performing routine laboratory duties, such as pouring, trimming models, fabricating bleach trays, fabricating night guard, are essential to the dental office. When we trim study models, we want to articulate the models together. What does that mean? That means the maxillary and mandibular casts come together as they do in the mouth. It's a reproduction of the patient's bite. And we need to have that so we can have a nice set of study models. If they don't come together, we need to grind off the excess stone that's prohibiting the teeth from articulating. Once the teeth articulate, we can determine which arch goes back the furthest so that we don't cut too much of the back of the study models. When we're determining the one that goes back the furthest is usually the maxillary. We want to make a midline, kind of look at how the midline goes, and we can use a pencil to use that. And then behind the molars, we can draw a perpendicular line and maybe use a little extra. Don't cut it too close. Step 2. Once we put that pencil line, which is perpendicular behind the molars, and we give ourselves enough space, then trim that model. After the model's been trimmed with a straight parallel line, we'll articulate both the models and trim them together. And ideally, we want them to stand up straight on their sides. Step 3 comes, we have to determine which arch is the widest. And generally, it's the maxillary arch. But be careful, patients may have a crossbite. You want to make a diagonal line on each side of the arch, and starting with the maxillary. And then once you've got that diagonal line created, then you can go ahead and trim. Trim both sides. But one of the most common errors assistants do is they don't give themselves enough space. And if they don't do that, they may be cutting their teeth. So give yourself enough space. And then trim both sides of the arch. Once those are trimmed, then you can articulate them just like the back line. And then they must stand on each side. Key points. The maxillary arch must have a point at the midline, and then it has points on the cuspid. Then the mandibular has points on each cuspid, but the anterior portion is rounded. So those are some of the points that we learned about study models.